Was before starting the class, you have to attend the dissection today and tomorrow only. Is it clear? Because it was wrongly placed in the notes. Notice board, it was mentioned that there will be no theory and practical from 9 onwards. But I told him that I had announced in the DH. Good. Maintain your sincerity. I like this. This batch is nice. Okay, today I will talk about the brachial plexus. Brachial plexus is a network of the nerve fibers. It is a network of the nerve fibers which are supplying to the complete part of upper limb. Alright. This nerve plexus extending from neck to the axilla, and how it is formed, that we will talk. Before talking of the nerve plexus, let's see the spinal nerves. There are 31 pairs of the spinal nerves. These nerves in the cervical part, in the lumbar part, are dividing into each spinal nerves, they are dividing into the divisions, anterior division and posterior division. Listen, I am not speaking the division of thoracic part. The thoracic part is not dividing into the anterior and posterior division. Rather, they are supplying the cutaneous branches to the intercostal nerves and also to the intercostal muscles. While the remaining part, these spinal nerves, they are dividing into the anterior division and posterior division. The ventral rami, again I am using the word only the ventral rami or the anterior division. Follow? Of these nerves, they are joined and forming the plexus. These plexus in the region of neck are forming the cervical plexus. The ventral rami of C3, C4 are joining and forming the cervical plexus. In the case of lower part of this subscapular nerve or cervical nerves, they are, that is lower part, C5, C6, C7, C8 and T1. The ventral rami of the lower part of the cervical nerves and T1 again join and forming the plexus. That plexus is called brachial plexus. The lower part, the ventral rami of the lumbar and sacrum, again they join and forming the lumbosacral plexus. First is the lumbar plexus, and the lumbar plexus joined with the sacral plexus. They are forming the lumbosacral trunk. That we will talk later on. So don't consider at present. At present, give attention towards the brachial plexus. So brachial plexus is formed by the joining of ventral rami of C5, C6, C7, C8 and T1 nerves. Normally. But they also having the slight contribution from the C4 or T2. I am using the word slight contribution. Now what happens? Normally the brachial plexus is formed by the ventral rami of C5, C6, 7, 8, T1. If there is a contribution from the C4 is large, in case the T2 contribution is completely absent, there is no T2 contribution because the C4 contribution is large and the C5 is also reduced. Such type of the brachial plexus in which there is larger contribution from C4 the C5 contribution is also small and no contribution from T2. So what remains left? C4, slight part of the C5, 6, 7, 8, T1. Such type of brachial plexus is called prefixed brachial plexus. That is called prefixed brachial plexus. Just opposite to this, no contribution from C4. Rather, the contribution from T2 is larger. The T1 contribution is smaller. Such type of brachial plexus is called postfixed brachial plexus. So I told you two things. Normal brachial plexus, which is formed by these lower part of the cervical nerves, ventral lemma of the cervical nerves, and T1. But there is slight contribution from the C4 and T2. Have you think one point? The contribution from C5, C6, C7, C8, T1. Right? What happens to the C2, C3, C4? Remember, what is the cutaneous supply above the horizontal line of the pectoral region? That is from C2, C3, C4. Okay, so the branches ventral lemma from C2, C3, C4, they are supplying the cutaneous branches of the pectoral region above the areola or the nipple. Okay, because of that, the contribution of the brachial plexus is from C5, C6, C7, C8, and T1. So I hope you understand the answer. If anyone asks you what happens to the C2, C3, C4, they are providing the contribution in cutaneous nerves above in the upper part of the pectoral region. Okay? And prefix and postfix brachial plexus are clear to you. And one thing I told you that the brachial plexus extend from the neck to the axilla. In the neck region, they are present. Okay, before that, we must know that what are the different components of the brachial plexus. For that, see this diagram. Look here. This is the spinal cord. C5, C6, C7, C8, T1. Okay. The nerves from the C5 or C6, anyone, all these they are attached to the spinal cord by the two roots. One root is this, another root is this. These are called ventral root and dorsal root. Each spinal nerves, they are connecting with the spinal cord by means of two roots. The anterior root or the ventral root, that is motor. The dorsal root, which is showing the ganglion, dorsal root ganglion, is sensory. Okay? So what are these? These are the ventral lemma. The ventral lemma of C5, the ventral lemma of the C6, both are joining here. The roots of C5, ventral lemma of C5, ventral lemma of C6 join here and forming the trunk. This trunk is called upper trunk. How the upper trunk is formed? By the joining of ventral lemma of C5 and C6. Then see the next one, C7. The ventral lemma of C7 is not joining with anyone. It remains separate and it is forming the part middle trunk. Then see the ventral lemma of C8, T1. Both are joining here and forming the lower trunk. So point is this, when we see the components of the brachial plexus, the brachial plexus is having the roots, trunk, and as we see, each trunk is again dividing. Each trunk is again dividing here, anterior division and posterior division, anyone. Also the middle trunk is also dividing into the anterior and posterior division, same to the lower trunk. So third component is division of the nerves here. After that, the division of the nerve, they are joining with each other and forming the cords. So the cord which is present lateral side, that is called lateral cord, and medial cord and posterior cord. All these are the components of this. Then these cords, they again dividing into the branches. So that is how the brachial plexus is formed. All right, let's see. The roots and trunk, they are present in the neck region. So while doing the dissection, keep in mind, don't speak roots and trunk here. Try to understand. Roots and trunks of brachial plexus, they are present in the neck region. Second, the trunks which are upper trunk, middle trunk and lower trunk, they are dividing into the anterior division and posterior division. So can we say this is a division of the nerves? And division of the nerves is lying behind the clavicle. This is the clavicle bone. So the division of the nerves is lying behind the clavicle bone. All right. Then what happens that these division again join and forming the cords. So next to the below the clavicle there is present the cords, and each cord again dividing into the branches. So cords and branches, they are present in the axilla. So while doing the dissection of axilla, what part you will see? Cords and branches. Okay, is it clear? Behind the clavicle, what parts or what components of brachial plexus is present? Division of the brachial plexus. And above the clavicle, there is the part of trunk and roots. We can divide this whole brachial plexus by seeing this diagram. The part of brachial plexus above the clavicle, that is called supraclavicular part. That is called supraclavicular part. And supraclavicular part includes roots and trunk. The parts of brachial plexus lying behind the clavicle, that is called retroclavicular part. And the part of the brachial plexus, that is cords and branches, they are lying below the clavicle. So they are named as infraclavicular part. Infraclavicular part of brachial plexus. I think no problem till next. No? Good. As the brachial plexus coming from the where the roots and trunks are present, in the neck region. In the neck region, they are present between the scalenus anterior and scalenus medius muscle. Then from here, they are coming down and lying over the first rib. Reaching behind the clavicle, they form ribs. The division takes place. The division is lying behind here. And as they come into the infraclavicular part of the brachial plexus, it is lying in the axilla. And in the axilla, the cords, what is present in the axilla? Cords and branches. The cords of the brachial plexus, they are enclosed with the axillary artery and axillary vein. This whole structure is covered by sheath, and that sheath is called axillary sheath. So here you keep this point in your mind. While doing the dissection of axilla, you will see the axillary artery, axillary vein, and combined with this, there is the cords of the brachial plexus. The whole three structures are covered by the axillary sheath. So while doing the dissection, this should be in your mind that what are the structures present here. Okay? After seeing this, the next part, look here. You can very clearly understand here. I am telling the another point. This is the root C5, C6 forming the upper trunk, C7 forming the middle trunk, and C8, T1 is forming the lower trunk. Okay. Each trunk then divides, and the division of each trunk into the anterior division and posterior division. The posterior division of all these three trunks. Listen, posterior division of the upper trunk, posterior division of the middle trunk, and posterior division of the lower trunk. All these three join together and forming the posterior cord. So how the posterior cord is formed? By the division, by the joining of posterior division of the upper trunk, middle trunk, and lower trunk. So all the posterior division are joining together and forming the posterior cord. Okay. The upper trunk, which is formed by the C5, C6. Look here. So this is the part of upper trunk. The anterior division of the upper trunk and anterior division of the C7. Anterior division of the upper trunk, that is C5, C6, and anterior division of the middle trunk, that is C7. These are joining and forming the lateral cord. So what is the root value of lateral cord? C5, C6, C7. Is it clear? कैसे बनती है lateral cord? Anterior division of the upper trunk. And how the upper trunk is formed? C5, C6. Okay? And it is joined with the anterior division of the C7. And all these three are forming the lateral cord. So root value of the lateral cord is C5, C6, C7. Then look here. The anterior division of the middle, the lower trunk, and look here, the anterior division of the C5, C6 upper trunk. See this clearly. I will speak later on. What is this? Anterior division of the lateral cord, and this is the anterior division of the lower or posterior cord. So what will be the root value of here? 5, 6, 7, 8, T1. And this is the form of the nerve, median nerve, that we will talk just later. So now look the medial cord. How the medial cord is formed? Medial cord is formed by the C8, T1. Root value of the medial cord C8 and T1. Okay. Root value of the posterior cord is C5, C6, C7, C8 and T1. So three cords are formed. Lateral cord, medial cord and posterior cord. Now these cords, they are present along the axillary artery and axillary vein in a common sheet. Now what happens that each cord is giving the branches. The branches of the brachial plexus arise from the root, upper trunk, and posterior cord, medial cord, and lateral cord. Now look this diagram. Look here. This is the ventral rami of C5. The ventral rami of the C5, that is from the root. So I am telling you first the branches, the nerves which are arising from the root of brachial plexus. From the root of brachial plexus, the nerve which are arising, one is the dorsal spinal nerves, which is root value is C5. कहाँ से arise हो रही है? Ventral rami of C5. So this is called dorsal scapular nerve. This dorsal scapular nerve, the root value of it is C5. It is supplying to the muscle of levator scapulae, rhomboides major, rhomboides minor. Okay, I hope you have gone through these muscles. Name, levator scapulae, Rhomboid is major, rhomboid is minor. The nerve supply of it is dorsal scapular nerve. And this nerve is injured in the person who are holding the weight, heavy weight on their trunk. The persons who are carrying the heavy weight on their upper part of the thoracic region, this nerve can be injured or compressed. Due to compression, they may complain of the pain along the medial border of the scapula, and that pain may radiate towards the lateral side of the arm. Okay. Next to this, the another nerves which are arising from the root. See this long root nerve coming from C5, C6, C7, C8, and the part of this. So, what will be the root value of this? C5, C6, C7. The nerve is called long thoracic nerve. It is supplying to the serratus anterior muscle. Long thoracic nerve, which is coming from the root of brachial plexus, and the root value of it is C5, C6, C7, and it is supplying to the serratus anterior muscle. What is the action of serratus anterior muscle? Protraction of the scapula. Okay. If this nerve is paralyzed, and what happens in the winging of the scapula? Normally the medial border of the scapula is not raised, but in that case the medial border of the scapula is raised, and the person cannot raise his hands above this part. That is winging of the scapula. How it does result? Due to paralysis of the long thoracic nerve. Okay. So if you will read like this, then it will be very easy to understand, rather cramping the structure. समझ के पढ़ोगे तो याद रहेगा. All right. Besides this part is also giving the nerves to the scalenus medius, scalenus anterior, and scalenus posterior. So scalenus muscle is also supplied by the nerves coming from the roots of brachial plexus. Then we come to the root and trunk. This is the upper trunk, this is the middle trunk, and this is the lower trunk. Neither the middle trunk nor the lower trunk are giving any branch. Are you here? No branch coming from the middle trunk and lower trunk. Only the branches are coming from the upper trunk. The two branches coming from suprascapular nerve and the nerve to the subclavius muscle. So these are the two nerves which are arising from the upper trunk. Nerve to subclavius and suprascapular nerve. The suprascapular nerve is supplying to the supraspinatus and infraspinatus muscle of the scapula. Nerve to subclavius is supplying to the subclavius muscle. I hope you remember the subclavius muscle. What is the action of subclavius muscle? Stabilize the clavicle during the movement at shoulder joint by pulling the medial end of the clavicle downward. By pulling the medial border of the clavicle downward. How it arises? It is arising from the first costochondral junction. The first rib which is articulating with the sternum, that is first costochondral junction. So from there the muscle arises and inserting over the subclavian groove of the clavicle. So the subclavius muscle pulling down the clavicle downward and keep steady by pulling the clavicle, medial end of the clavicle downward during the movement at the shoulder joint. Nerve supply of this muscle is coming from the upper trunk. Okay. But the problem is not end. This point of the upper trunk, where the two nerves, suprascapular nerve and the nerve to subclavius. And see here, what are these? Root of the C5, root of the C6. Total number is 4 or not? Two roots, these 5 and C6. Two nerves. What is the total number? 4. And see here, the upper trunk is dividing into the two divisions, anterior division and posterior division. So can I say the meeting point of upper trunk, the meeting point of the upper trunk where the 6 nerves are meeting, मैडम लिख लीजिए, समझ में आ जाएगा. Meeting point of the upper trunk, meeting point of the 6 nerves, meeting point of the 6 nerves at the upper trunk is known as earth point, ERBS, earth point. ERBS, earth point. The meeting point of the 6 nerves at the upper trunk. What are these? The root of the C5, root of the C6, the nerve to subclavius, suprascapular nerve, and the anterior division and posterior division of the upper trunk. So total number is 6. So meeting point of the 6 nerves at the upper trunk is called earth point, ERBS, earth point. This is the common site which is causing the earth paralysis. Earth paralysis, that I will tell you later on. Earth point, you should be clear about the earth point. Injury of the at this point, earth point, is named as earth paralysis. That I will talk later. Okay. Now let's see how the cords are formed. What is this? The anterior division of the C5, C6 upper trunk, anterior division of the middle trunk joining here and forming the lateral cord. Okay, no problem. Root value of the lateral cord is C5, C6, C7. Now see the branches of the lateral cord. It is giving the lateral pectoral nerve, supplying to, what is the nerve supply? Pectoralis major and pectoralis minor, lateral and medial pectoral nerve. Understand? And lateral pectoral nerve is coming from the lateral cord. Lateral pectoral nerve is coming from lateral cord. Then what is the root value? C5, C6, C7. Okay. Then see the musculocutaneous nerve. The musculocutaneous nerve, again the root value is same because it is coming from lateral cord, C5, C6, C7. It is supplying to biceps, brachii, brachialis, and coracobrachialis. All these muscles are supplied by the musculocutaneous nerve. Then one more branch. Look this one. See carefully. This branch is coming from lateral cord, coming down and joining here with the medial root of medial cord. Both these roots, lateral root and medial root, join here and forming the nerve that is median nerve. So the another branch coming from the lateral cord is the lateral root of median nerve. Lateral root of median nerve, this one. So these are the branches coming from the lateral cord. Any doubt? Okay. Now see the part of the medial root, that is this one. The root value of the medial root is, yes, what is the root value of the medial cord? C8T1. I am talking of this C8T1. The anterior division of it is coming down and it is giving rise. So I am talking of the medial cord, the branches of medial cord. Okay, lateral branches of lateral cord we have discussed. Now see the branches of medial cord. The branches of medial cord, it is giving, the one is the medial pectoral nerve, which is supplying to the pectoralis major and pectoralis minor. After this, it is also giving the medial root, this one, medial root of the median nerve. The medial root of median nerve joined with these two and forming the median nerve. Okay, no problem. And C, another important branch, it gives the ulnar nerve. Ulnar nerve is present on the medial side of the forearm and the root value of it is C8T1 and also make contribution from C7. Alright. Besides this, there are the two more branches of medial cord and these branches are medial cutaneous nerve of arm and medial cutaneous nerve of forearm. These are. Any problem up to the two cords? No? Now see the posterior cord. Posterior cord, it is giving the branches. One is upper subscapular, another is lower subscapular. What is the name? Subscapular. Any muscle with this name? Subscapularis. So they are supplying to the upper part of the subscapularis and lower part of the subscapularis. Upper subscapular and lower subscapular, coming from the posterior cord of the brachial plexus. Then there is also the T, thoracodorsal nerve. Thoracodorsal nerve, which is supplying to the latissimus dorsi muscle, this muscle, which helps in raising when we hold anything and raise our body during the exercise. Nowadays the gym is almost closed. Otherwise, most of you moving to the gym. What are you doing in the gym? Hold the bar and keep your body upwards. In these, the muscles are used, latissimus dorsi and the part of deltoid and this. Okay, so nerve to latissimus dorsi is supplied by thoracodorsal nerve, which is also the branch of posterior cord. Then it is giving the two important nerves. One is the axillary nerve, this one. The axillary nerve root value is C5, C6 only. It is supplying to the very important muscle, deltoid. It is supplying to the deltoid. And also the radial nerve. Root value of it is 5, 6, 7, 8, T1. So these are the various branches coming from the brachial plexus. Now, is it clear that brachial plexus is giving the nerves which are supplying the complete part of the upper limb? Okay, no problem. Now see this diagram. As I told you, what are the relation of brachial plexus in the axilla? This is the pectoralis minor muscle. This pectoralis minor muscle, this is the axillary artery. This axillary artery is dividing into the two parts by the pectoralis minor muscle. The part of the axillary artery before the pectoralis minor muscle, that is the first part of the axillary artery. The part of axillary artery behind this pectoralis minor, that is the second part of axillary artery, and beyond the pectoralis minor, that is the third part of axillary artery. The point is, by the pectoralis minor muscle, we divide the axillary artery into the three parts. first part, second part and third part. The second part is lying behind the pectoralis minor muscle. Okay. Now see the relation. The first part of axillary artery lying on its lateral side, you are seeing the lateral cord and posterior cord. So posterior cord and lateral cord of brachial plexus are situated lateral to the first part of axillary artery. And the medial cord, that is this one, the medial cord is lying on the posterior part of the first part of axillary artery. Then see the second part of axillary artery lying on the lateral of the second part of axillary artery. What is this? Lateral cord. So lateral cord is lying lateral to the second part of axillary artery, and the medial cord is lying medial to the second part of axillary artery. And see the interrupted line. This is the posterior cord of brachial plexus, which is lying posterior to the second part of axillary artery. Then the third part of axillary artery lying on its lateral sides, there is the branches of musculocutaneous nerve, the median nerve and this. And similarly on this side, this is the axillary vein and lying over this median cutaneous nerve. So that is the relation of brachial plexus. After this, I am coming to see this point. This diagram is very important. This is called Earth's point, commonly asked in short notes. Earth's point is the meeting point. It is the point of upper trunk. Earth's point is the point of upper trunk where the 6 nerves are meeting. And see the ventral MI of C5, ventral MI of C6, 2, and the suprascapular nerve and nerve to subclavius. Total number is 4, and each is dividing into the anterior division and posterior division. So keep this diagram in your mind. You will never forget. That is called Earth's point. Injury of here is called Earth's palsy or the Earth's paralysis, that I will tell you just now. So it is clear what is the Earth's point. Now look the person. This person fell from the above height. Person fell down from the height. In what position? In outstretched hand or on the shoulders. See this very clearly. कैसे गिर रहा है? At the point of shoulder. So what happened? This is the head and this is the shoulder joint. So the angle between the head and this shoulder joint is increased. Okay? When the person fell down from the height, lying over the shoulder joint, touching the shoulder joint, the angle between the head and neck and the shoulder joint is increased. And this increasing angle resulting into the pressure over the Earth's point, that will cause the Earth's paralysis. समझ लीजिए, ऊपर से गिर रहा है, कैसे गिर रहा है? शोल्डर ज्वाइंट टच कर रहा है, तो एंगल कैसे हो गया? इंक्रीज. And due to increasing of this angle between the head and neck and the shoulder joint, resulting into the compression or may injured at the nerves at the Earth's point. Due to this, the person is showing the typical position. Have you seen the waiter? How they take the tip? Like this. Or policeman, constable, how they take the tip? What is the position? The arm is adducted. One thing, and it is also medially rotated. No flexion at the elbow joint. Okay, right? And what is the position of the hand? flex at the wrist joint, like this. So what happens in the earth paralysis? The person is coming in the position of waiter's tip position or policeman tip position. What is the waiter's position, tip position? The arm is adducted, medially rotated, and the pronation of the forearm and flexion at the wrist joint, like this. But how this happened, that I am telling. Adduction of the arm, because due to paralysis of the deltoid and supinator. Due to paralysis of the deltoid and supinator. Supinator is the muscle which initiates the abduction. Listen carefully. Supinator muscle is the muscle which initiates the abduction. What is the abduction? This one. So, this supinator muscle is paralyzed and deltoid is also paralyzed. What is the nerve supply of deltoid? C5, C6. So, that is also injured. So, due to this, the person cannot abduct arm. The arm cannot be abducted, so it is adducted. Then second thing, let it is medially rotated. Why it is medially rotated? The reason is because infraspinatus muscle is responsible for lateral rotation of the arm. So infraspinatus muscle is also injured. So the arm is medially rotated. Extension at the elbow joint, no flexion at the elbow joint. The answer is biceps brachii and brachialis muscle is also injured. So no flexion at the okay. Pronation, because biceps brachii and the part of the supinator, they responsible for the supination. This is supination. So these two muscles are paralyzed. So no supination. What will be position? Pronation. Then flexion at the wrist joint, because the part is that the muscle of this region, extensor muscles, they are not working properly. So the person is flexion at the wrist joint and backward. So all these things occurs in the earth paralysis. Okay. So I hope now it is clear to you. Earth paralysis. Another cause of the earth paralysis, being a doctor, it is very important. The student who will become gynecologist, they must know very clearly by the delivery of the baby. Look here, if we deliver the baby like this, the neck angle between the head and neck and this wrist joint will be increased. See this diagram. This may also cause the earth paralysis. So while delivering the baby, keep this thing in your mind. Don't increase the angle between the head and neck and the shoulder joint. So these are the 2 points responsible for the earth paralysis. Look here, this is the policeman tip position and resulting due to earth paralysis. See this one. What happened? The person when fell down from the height, if they think anything to hold, they will hold either the trees or any bar. The person is holding the bar. Okay. Now what happens? That here the angle, there is more abduction between the part of this, and either the second point, while the delivering the baby, if this type of delivering where we take the hand of the baby and taken out, deliver. This is called breech presentation. Breech, B-R-E-E-C-H, breech presentation. So what is the breech presentation? When the baby is delivered by the holding the hands. In the breech presentation, if the doctor is catching or hold the hands stretched very largely, again this will increase the abduction is more. That will also result in the injury of the lower trunk of brachial plexus. I am using the word lower trunk of the brachial plexus. What are those? What is the root value? Lower trunk of brachial plexus. CAT1 or not? So they will result into the injury of CAT1, and this is called Klumpke's paralysis. Klumpke's paralysis. K-L-U-M-P-E-E-S. Klumpke's paralysis. But still the problem is not solved, because we have seen it is resulting due to outstretched hand delivery, or the person is fell down from the height and holding the anything bar or tree. What will be the position of the person? The person will show claw hands. The person will show the claw hands like this. This is the claw or not? So person will show the claw hands, and this claw hand is resulting there is extension at the wrist joint. Extension at the wrist joint. This extension at the wrist joint due to failure of the flexor digitorum profundus and flexor digitorum superficialis. When these two muscles are not working, paralysis, there is no flexion at the wrist joint. Second thing, the interossei muscles of the hands, lumbricals and the interossei muscles of the hand are also paralyzed. So they will result extension at the metacarpophalangeal joint. These are the metacarpal bones, these are the phalanx, and this joint is called metacarpophalangeal joint. So look here, extension at the wrist joint, extension at the metacarpophalangeal joint, but there is a flexion at the interphalangeal joint. So this is the position. This is called claw hand, and claw hand is resulting due to injury of lower trunk of the brachial plexus. Clear? Okay. All these are the injury due to involvement of motor and sensory nerves. Okay, motor and sensory nerves injury. But what happened? That there are the one more thing developed. That is called Horner syndrome. Horner syndrome, H-O-R-N-E-R-S, Horner syndrome. Now see, what is the Horner syndrome? The sympathetic fibers, listen carefully then write. The sympathetic fibers of head and neck region, they are running along the T1 fibers. The sympathetic fibers of the head and neck region, they come along the T1 fibers and then they join here with the inferior cervical ganglion. This sympathetic fibers is responsible for the sympathetic supply of the face and neck region. What happens? Due to injury of lower trunk of the brachial plexus, if this sympathetic fibers is also involved, then the person will resulting into on affected side, there is a dropping of the upper eyelid. Upper eyelid will be dropped. If you ask the patient to raise the upper eyelid, cannot. So upper eyelid, dropping of the upper eyelid. Second thing, eye wall will be increased. That is called anophthalmos. Eye wall is increased in size or bulge. That is called anophthalmos. Enophthalmos. Anophthalmos. There is constriction of the pupil. The pupil will come narrow. Constriction of the pupil. No secretion on the affected side. On the affected side. All these are the conditions seen in the Horner syndrome. I am repeating again. Due to involvement of the sympathetic fibers. Due to involvement of the sympathetic fibers. लिखना सीखोगे जब ये लिखा जाएगा. नहीं एग्जाम में भी ऐसे बैठे रहोगे. समझ गए? बहुत स्टूडेंट्स है आपके सीनियर्स भी वैसे ही बैठे रहते हैं टाइम पास करते हैं. डेवलप द हैबिट. अभी लिखोगे गलत भी लिखोगे तो चेक करना. समझ लो. डोंट सिट आइडल. The sympathetic fibers which are supplying to the head and neck, if they are involved in the lower trunk of brachial plexus injury, the person is showing the Horner syndrome, Hornor, Horner syndrome. And what will be the condition in the Horner syndrome that I told you? Constriction of the pupil, upper eyelid dropped, and eye wall is enlarged. That is called anophthalmos. No sweating on the affected side that are seen in the Horner syndrome. These are the questions comes in the MCQ. Very simple. What happens in the MCQ? That is involvement of the sympathetic fibers. All right, all these are the applied about the brachial plexus. But old age persons always keeping problem to the doctors. They came to the doctor. डॉक्टर साहब मेरे यहाँ पे सेंसेशन लगता ही नहीं, सेंसेशन हो रहा है. मीडियल साइड पे ऐसा लगता है सूनापन है या पेन की कंप्लेंट करें. When doctor do their X-ray, they notice that there is the part, the C1 fibers, the sympathetic fibers which are passing about the first rib. The sympathetic fibers which are passing above the first rib, they may be compressed by the part of the prolongation of the scalenus anterior muscle. In some cases, the scalenus anterior muscle is enlarged. So, the prolongation or the enlargement of the scalenus anterior muscle may also compress the upper trunk of the brachial plexus or C81 fibers. So, due to compression of the C81 fibers, the same thing which we seen in the Klumpke's paralysis are complained by the patient, that no sensation on the medial cutaneous nerve of the arm. That is, what is the medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm? That is coming from the ulnar nerve, the medial cord. So, patient may complain of no sensation on the medial side of the arm and forearm. So, this is called the scalenus anticus syndrome. Scalenus anticus syndrome is there is enlargement or prolongation of the scalenus anterior muscle. It may compress the medial cord. So, that is all about the applied and brachial plexus. Anything which you are not clear? Okay, boys. So you are supposed to come in the DH. Okay, today and tomorrow. And what you will do in the DH, revise the whole part which you have gone through this today's class. Or any problem, don't hesitate. Ask the teacher. Right? Develop this habit. Don't take any doubt in your mind. If you are keeping doubt in your mind, cannot become a good doctor.